Nitropaste, a common trade name for it might be Nitro-Bid ointment. It is very similar. It is the same thing as nitroglycerin tablets or spray like we just talked about. So review that video as well. You will probably see this more likely on transfers and stuff. Not real common to actually have Nitropaste on a truck. We usually stick with the spray or tablet, and then they get Nitropaste put on in the ER, and then we might take a transfer with them on it. So, like mentioned, it is a vasodilator. It causes smooth muscle relaxation that can cause vasodilation and smooth muscle relaxation all over the body, not just in the vasculature. Whenever it does happen in the vasculature, though, it decreases preload and afterload on the heart and reduces myocardial oxygen demand, so the heart doesn't have to work as hard to pump. Pregnancy class for it is C. Indications: chest pain, hypertension possibly, and then CHF exacerbation is also another indication for it, and that pulmonary edema. Contraindications: hypotension, hypovolemia, hemorrhagic stroke, or any head injuries, severe bradycardia or tachycardia, right ventricular infarct because it decreases preload, and if you've got a damaged right ventricle as well that can't pump as hard, you can really cause some severe hypotension with it. So that's why that's there for right ventricles. And then erectile dysfunction meds in the past 48 hours. It works kind of synergistically with other with the erectile dysfunction meds in dropping blood pressure. So if they have taken any of those, then it can lower it drastically. Adverse reactions: it is going to cause a drop in blood pressure. Whether that causes a patient to become hypotensive or not depends on who you're dealing with, but it will cause a drop in blood pressure. Can cause headaches, dizziness, weakness, reflex tachycardia, syncope, hypotension, nausea, vomiting, or diaphoresis. It does have an additive effect with other vasodilators, like we talked about with ED meds. I did not delete that out. Must use a separate IV line. We're talking about paste here, so that doesn't apply. The dosage: it is the only drug out there that I've ever heard of that is measured in inches. It's not measured in milligrams, not measured in the metric system like everything else in the medical world. It is measured in inches. So typical dosing, start at is 1/2 to 3/4 of an inch and placed on the chest. They say a maximum would be 5 inches. I don't know. And then you're going to put it on their chest wall and then secure it down and cover it up. For the kids, it's not recommended. Onset starts working in about 30 minutes. It is having to absorb through the skin on the chest, so it takes a while to get through that. Peak effects, which varies based on the patient, and it does stay working for 18 to 24 hours or until you wipe it all off, and then it stops working within a few minutes, 15 or 20 minutes, something like that. Something to keep in mind: protect it from light if possible, cover it up with a bandage of some sort. Something else to keep in mind: if you are taking somebody that has Nitropaste on and they suddenly become hypotensive, start having worsening cardiac output issues, whatever it might be, the first thing you should do is take that Nitropaste off and wipe the skin clean so you can stop that from working anymore. If they then stabilize and can start having chest pain again, we can start getting them shots of nitro sublingually, but that's kind of a first line of treatment for someone who's possibly becoming hemodynamically unstable, would be to remove that Nitropaste.